It's impossible to face the vitamin shelf at any supermarket or any drugstore and know what to do. So to clear up the confusion, GMA's medical contributor Marie Savard, Dr. Savard, is here with us this morning. You heard the four of us sitting on this sofa saying not one of us takes a multivitamin. To us, doctor, you want to say?
I want to say, Diane, it's actually a good thing to take one single multivitamin a day.
You say everybody should do it?
Everyone should. First of all, choose a name brand vitamin. You're overwhelmed when you go to the supermarket, no question.
Definitely.
A name brand, I know what's in that. And if you think about it, there's a number of things in each multivitamin that covers us, because guess what? We don't eat the way we should. There's no question about it.
So take a name brand vitamin every day, all of us. If it just says one, that's okay. If it says take 2 or 3, beware of that bottle.
That's right. Be suspicious. A multivitamin, a good complete multivitamin, you should have everything you need in one tablet or one capsule.
And is there a time of day that's better than another time of day? And should you do it with food, or does it matter?
People often ask that. It doesn't really matter. I take mine first thing in the morning because that's my habit, my routine. It's going to brush your teeth, take your vitamin. You could take it at night. Some people find the iron for women in the vitamin might upset them a little bit. Take it at night before you go to bed. Doesn't matter.
Let's talk about women and men. There are differences, and you tell me whether that means you supplement your one-a-day vitamin or you choose a different kind of vitamin. For women, what particularly do you want included?
Women want a complete multivitamin. Why? They need iron. They need extra iron for their menstrual losses. They need folic acid in case they get pregnant, for the fetus. And then they need the vitamin D and calcium, which is in a complete multivitamin. That's what women need.
And the omega-3s you've talked about, are they always in the multivitamin? Should you make sure they are?
It doesn't come in the multivitamin. It's an oily capsule. I recommend that you also take omega-3s because we don't get enough seafood. We don't get enough of the omega-3s. Also, you need to take separate vitamin D, more and more research on vitamin D. So you have to take a little bit more vitamin D and more calcium. Calcium is a big pill. It's hard to put into that multivitamin. I like the Tums or the chewable caramel ones because you can swallow them and they're sort of easy.
But why do we stress calcium and vitamin D with women and not with men? Do men have more calcium than women?
No, but you know what? Men have testosterone. They have the hormone that actually builds a greater bone mass so that they start out with stronger bones. They still need calcium, and we're learning that men need vitamin D as well for heart health, autoimmune diseases, even protecting them from cancers. But men don't need iron. So I recommend for men taking a different multivitamin, something called Centrum Silver, for example. Silver means gray hair. Postmenopause, you don't need the iron. Iron can actually mask a hidden bleeding problem. It can be hard on you, and as a man, you don't need it, so you shouldn't take it.
So the big differences are more calcium for women. If you're premenopausal, iron. But if you're postmenopausal, no iron for women or men.
That's right. So what I would really like to say is for seniors, which are lots of folks out there, they really should think about taking something called a Centrum Silver or the equivalent. It doesn't have the extra iron, but it has lots of vitamin D, calcium, all the other nutrients that they're probably not getting in their diet.
And there's one thing you mentioned for eyes too, lutein. Am I pronouncing it right?
Lutein, that's right. It's a really important antioxidant that is stored in the pigment of the eye. It works really well with the omega-3s. The two of them are really important, but again, you get it in the multivitamin. Don't necessarily start complicating things by taking a lot of extra things. A good all-purpose multivitamin, add a little calcium, vitamin D, which will soon be packaged, I think, with the vitamins as the recommendations change, and that fish oil if you're not getting lots of oily fish.
Okay, so have to do a multivitamin every day. I'm going to go monitor Chris, Sam, and Robin here.
And I'll monitor you.
And you monitor me, exactly. And stick with the name brands because they are controlled and regulated.
Yes.
All right, thanks so much, Marie. It's helpful. You can get more good tips, of course, at abcnews.com about vitamins, so many other medical things. It's a great web page to check out all kinds of medical advice.